My name is Nasrin Sultana. I'm a postdoctoral scholar at McGill University and also a CSPC volunteer. Today it's my pleasure to welcome Dr. Tim Evans, Vice President of Research, Innovation and Impact at Concordia University. Thank you very much, Dr. Evans, for being here. So you have played a key role in taking many global healthcare initiatives. Could you please give us some example of how those initiatives helped in advancing inequalities and strengthening the healthcare system's delivery?
Sure. Well, I think to start that early on in my career, one of the things that I found concerning as somebody who was trained as a doctor, a medical doctor, but also as an economist, a development economist, that there are huge differences in life chances across geographies. And there was no good reason why a child in Bangladesh should not have the same survival as a child born in Canada. Yet there were significant differences. Or a mother in Sierra Leone should have 1,000-fold risk of death during pregnancy relative to a mother in Norway. And so the question became, well, what are the drivers of that inequality across countries? And we started thinking about some of them and looked at, well, what are the potential benefits of universal childhood immunization? Jim Grant, the UNICEF executive director in the 1980s, led a global campaign that for every child to be immunized. And when I was moving into global health in the 1990s, we'd slipped back a long way. And so we thought, well, how can we make sure that we can secure an opportunity for every child to be fully vaccinated, not only with existing vaccines, but with new vaccines that are coming on for new things like rotavirus and other important conditions. And so we worked towards a global coalition to make sure that every child had an opportunity to have universal vaccination, and that ended up being something called Gavi. And Gavi essentially was going to pool procurement across countries in such a way that the average price for a whole package of vaccines was about a 20th the price for countries compared to what you would have paid if each country negotiated with the vaccine industry on its own. The vaccine industry loved it because they were getting a much larger market than they would otherwise, right? So it was a win-win, and so we finally got that moving through something called Gavi, and that we launched that in 2000. And 25 years later, it's still going strong, and I think it's made a big difference. So that's one example of where there wasn't any existing or something you learned in medical school or in public health school that this was the way to address these issues, but working with people who are interested in finding a solution, we came up with a new idea, and it caught on.
Mm-hmm. That's interesting. And you have worked in universities, hospitals, and also NGOs. How do the drivers of innovation in this field differ, and what does that mean for the policymakers who want to catalyze cross-disciplinary or intersectoral collaboration?
Yeah. Well, there's some things that are the same, and or that are drivers of opportunities for innovation. And I think the most important one is a culture of innovation. And I think institutions that treat employees as leaders and give them rope to run are institutions that cultivate an innovation environment. And so I always encourage people, whether it's in a hospital or an NGO or in the government, not to ask for permission, but to ask for forgiveness, right? Move forward with what you want to achieve until someone tells you you've made a mistake. But if you say, can I move forward or should I move forward? Most of the time you'll hear, no, you can't, because you haven't thought of this or that, or we're doing something else, right? So that culture of innovation can be suppressed in NGOs, can be suppressed in hospitals, can be suppressed in government, but it can also be cultivated in those settings. I think sometimes less formal institutions that have a sense of a mission that they need to grow and they need to be dynamic, often NGOs are that way, can be real exemplars of entrepreneurial spirit and activity and innovation. And your country, Bangladesh, is perhaps the world's reservoir of some of the most incredible social entrepreneurs the world has ever seen. Sir Fazli Abed, who I had the privilege of working with, Muhammad Yunus, who's currently the acting head of state. And both of those individuals, I often say, have done more for the people's health than any formally trained health professional, right? It's because they were innovative and pioneering with respect to saying, well, how do we really improve the opportunities for women who are so critical in fostering opportunities for health of children, right? So NGOs often are at the vanguard. Smart governments pick up their programs and try and not only get them to scale, but sustain them at scale. So governments can come in. Hospitals can also be very entrepreneurial and innovative by listening to patients and then encouraging their staff to act on good ideas when they see challenges, shortfalls in the way that the system is set up. And that goes back to the culture that you want to cultivate.
That's true. And you have also pioneered many global partnerships. So in your opinion, what kind of funding or governance model can best sustain equitable and long-term collaborations?
Well, let me say something a little bit heretical. I'm not somebody who believes everything should last forever. And sometimes it's good to say mission accomplished. And that's because you've made enormous progress and perhaps the rationale for the initial fund or mobilization is no longer there. Or you failed. And that's part of learning. But it doesn't make sense to sustain efforts that are really not giving the results that you'd expect. So I think one is to be selective. Not everything that you start, and my career is littered with failure everywhere, and you learn from that, right? It's important to learn. But I think another thing is that conditions change, and one has to recognize that sustaining good initiatives that are making a difference often means redirecting them so that they're responsive to new contexts that could never have been anticipated. And we saw that, for example, during the pandemic. Nobody really anticipated the situation that we found ourselves in. And many had to pivot quickly, existing initiatives, to try and redefine where they could actually add value. And I think that willingness and ability to shift course and continue to be relevant is an extremely important characteristic of what I call a successful and sustainable initiative.
Yes, about shifting course. So under the current geopolitical uncertainty and shifting funding landscape, how can Canada position itself in the research and innovation policy landscape?
Well, I think uncertainty is a terrific opportunity for repositioning. And in the area of health, for example, Canada has been for too long, too dependent on research financing from the United States. About a third of our research financing has come from the National Institutes of Health over time. And now Canada has to sort of stand on its own. And this is an opportunity, for example, in the area of health research, to up our financing. And if you look at what we spend on health research as a percentage of our total health expenditure every year, it's way below the level that we should be spending. We spend somewhere about 0.4% of total health expenditure on health research. And we should be about 5 times that at 2%. And if we did that, you'd all of a sudden foster all sorts of new opportunities for innovation, provided you're smart in thinking about how to use those extra monies in areas that might be completely neglected, right? So we have a very big, fast-growing health system in Canada. We spend probably somewhere around $50 million a day extra every day on health. But we're not really asking the question whether we're spending that money in a way that's going to improve health for Canadians and improve the efficiency and effectiveness and the equity of the system, right? So to me, if we decided to put more money into research on the direction related to the performance of our health system, we might find that by cultivating young minds to focus on that we get all sorts of really, really bright ideas that could be game changers in improving our opportunities. So I see things, uncertainty as opportunity.
So how do you think the value of Canadian Science Policy Centre and its position in the community as a connection hub, knowledge mobilizer, and talent incubator in the innovation and research landscape?
Well, this is my first time at a CSPC meeting, and I have to say I'm delighted moving into my new role as a Vice President of Research of Innovation of Impact that the CSPC exists. I think it's incredibly important for countries to have an active discourse on science policy, especially now when we have an erosion of trust in science in the broad public, not only here in Canada, but in many parts of the world. Other parts of the world perhaps much worse than in Canada. But having an opportunity to get together annually with people from across the country in different parts of the research and innovation ecosystem to discuss the direction of science policy is, to me, absolutely essential. And I don't see other institutions doing this. So I think it's a terrific niche, and I'm delighted that we have a CSPC that's doing this.
Yeah. Thank you very much, Dr. Evans, for being part of the CSPC 2025 interview series.
Thank you for having me.
Thank you.